Welcome back to another episode of Full Time Hustler, the podcast where we dig deep into the stories of trailblazers, innovators, and disruptors in their industries. Today, I'm thrilled to have someone who truly embodies all three, a visionary leader in the healthcare space who's redefining how we access and pay for surgical care. Suzanne Webb is the CEO of Exclusive Surgery Solutions, a company that's making waves by simplifying the surgical experience and cutting costs for patients without sacrificing quality. Suzanne has a career spanning decades in the healthcare industry, from serving as a CFO for hospitals to founding her own medical billing company. Now she's leveraging all that experience to transform healthcare delivery with bundled payments and concierge care. But before we dive into the amazing work Suzanne is doing, let's start with something fun to break the ice. Suzanne, I have to ask, and as an icebreaker, uh, could you share a fun fact about yourself that isn't widely known?
So a fun fact is I'm the second oldest of 16 children.
Wow.
So that's how I learned to delegate and get things done.
If you could have dinner with any historical figure, who would it be and why?
𝘍𝙗 I'm not sure if you know her. She's an actress she was actually born in Vienna, but she had claim everywhere because she was one of the most beautiful women in the entire world. But then as she did her movies, she actually bought a studio, did her own productions. She actually got her own patent for actually radios and CBs back in the 50s. So this lady was brilliant. She actually started running her own things. And even in retirement, she would develop resorts and ski places in I think Aspen, Colorado. Just a woman who just kept doing everything. She actually got her own patents to do things before they sold the radio technology to the Navy. I mean, this lady was a trailblazer of trailblazers. So it's really fun to kind of look at her history and what she's done.
I love that. And on that note, let's jump into your professional journey. You've been in healthcare industry since 1988, working with hospital groups and serving as a CFO for hospitals. What inspired you to transition from these roles to founding Exclusive Surgery Solutions?
Actually, a lot of it happened after I switched over to it after leaving the hospitals just because I saw the need as ambulatory surgery centers and surgeons were going under because they didn't understand their billing. So it really was an opportunity for me to talk to the surgeons at the hospitals. And they're all like, I don't want to leave the hospital. And I was like, why? You're going to make so much money when you leave because you don't get paid as a hospitalist. You get to make your own money now. And they're like, we don't know how to do it. It's so complicated that you really have to understand how the game is played. And because I played it at the hospital level, I was like, you guys, I can show you how to make a ton of money. And so that's basically what I did. The surgeons started saying, please help us. And once I started doing that, that was a whole lot more fun. There's a lot more gray area that we could do in that than in the hospital billing. So it was just a natural transition. Once again, to just help the people that I knew and saw every day as to how can I help you guys? So
your experience includes owning a medical billing company focused on ambulatory surgery centers and surgeons. How did this background influence the development of Exclusive Surgery Solutions?
So moving from the hospital to ambulatory surgery centers, I didn't know what an ambulatory surgery center was. They are those small centers, and normally they're owned by doctors, not owned by hospitals. And so it's really something that no one really knew about, especially in the 80s. We only had, I don't know, maybe 100 nationwide. So there weren't a lot of ambulatory surgery centers, and it really was those plastic surgeons and some of the people. They were the only ones that owned them. And then eventually it started getting better credentialed, and then they could do orthopedics. They could do a lot more procedures. And then it started to get interesting. But once again, the rules were really vague as to how to get paid. They didn't really come out. They don't say, this is how you bill a claim, because insurance companies and nobody else wants you to get paid. So I went in and said, listen, we're restructuring everything you guys are doing to get the highest payment for what you're allowed to do. Taught all of them cost accounting, really looked at what the procedures cost, made sure that these guys that owned the building and all the rest of it were actually getting reimbursed the way that they should. And so that's really where I fell in love with the quality of the care. And what was amazing to me at ambulatory surgery centers, there was no infection. We had absolutely no infection at all. Everyone got better, and everyone was seen by a board certified surgeon. At the hospital side, we only had 3% of our surgeons were board certified. Everybody else were residents, just out of school, maybe a year under their belt. Well, for a lot of these specialties, you have to be in practice 6 years before you can sit for your boards. So I come into this industry and I was like, you guys are the best surgeons. All of you guys are writing the papers, teaching the guys that work at hospitals, but you're the guys that are actually doing it, and you're doing it better. And and the reason I say that is the numbers are so much higher. At an ambulatory surgery center, you can do 5 to 8 surgeries a day. At the hospitals before Obamacare, there's only 2 flips. You had one at 6 a.m. and you had another one at 1. Every surgeon was only doing 2 surgeries a day. That's all you could do. So that's where I was like, oh my gosh, we're more efficient. We can get more inventory. We can do more procedures. I can help you make a whole lot more money. And that was really the change. But then finding out how much the price difference was, I was like, I can help doctors make money. What I can't do in the current environment is I can't tell people which doctor to go to in town that does the best spine surgery, because it was illegal. So I had to go back to the drawing board and come up with a process that worked, that employers would pay for, because I had to be able to make money at this, and actually come up with a way that it would work. So by doing a bundled payment, which means I don't have a fee schedule for all of the individuals. So right now, a surgeon bills himself, the hospital bills themselves. We bill as a bundle. So as in a bundle, they couldn't look at, well, you overpaid the surgeon, or you overpaid anesthesia, or any of those individual pricing, because I sent them one claim with one number. So they're getting a bill for $22,000, let's say, for orthopedic surgery. They didn't get a breakout of what each of the payers were getting paid. So they couldn't hold me to a fee schedule. So then I figured out, now I can direct you to the best surgeon, because I have to pick the surgeon to do the bundle. So now I've got concierge level care, because nobody else in the country can tell you what doctor to go to. It's illegal. If United Healthcare said go to this, it's illegal for them to do that, because they're paying them and they have a fee schedule. I did it differently because I wanted the overall service level to be better, and I wanted doctors to get paid more, but I also wanted to make sure that we were holding them accountable. So because we know that an ambulatory surgery center has a 0 infection rate, I was able to say, if we get an infection, I'm going to lower your pay. Otherwise, I'm going to pay you the most money. But if the patient doesn't do well and they need a revision surgery or anything else happens, I take money back. So I can control my entire audience. And because of that, like I said, we've had no infections, no revision surgeries. Nobody's had to go back for, this, like 6 weeks later, we need to do, none of that happens, because I'm controlling the audience.
I'd really like to expand on one thing you're mentioning here that I think is really important for our listeners. Exclusive Surgery Solutions offers consumers improved access to quality surgeons and significant cost savings through bundled payments at select ambulatory surgical centers. Could you elaborate again on and highlight just how your company achieves these outcomes?
So the biggest thing is, one, we're going to go to the guys that have, one example here. We have a surgery center in Phoenix that actually has done about 5,000 hernia repairs with no infections. So the odds of me getting an infection there for any of the patients I send there, it's pretty slim, right? I can go to Banner down the street. Their general surgery wing right now has an 86% infection rate. Where am I going to send my patient and why? Now, Banner's going to make a whole lot more money on that patient because they're going to get an infection. They'll probably make on average $120,000 on a hernia repair. When I go to the surgery center, I'm getting the surgeon, the facility, and the anesthesia all for under $8,000. And you don't have any issue, and you go home and you can go back to your life. That's the difference in what I do. So it's not just one thing. It's I have to go to the right person who's going to give me a good outcome. I got to get the price points correct. Like I said, under $8,000 is pretty good because it's locked in. It's never going to get higher than that because I already have locked in what the price is going to be, and the surgeons accepted. There's no balance billing. Nothing ever happens because we pay them immediately, basically for the procedures and things they do. So we bill the TPA, and then we pay them very quickly, but we send one claim to the TPA. So there's not a lot of research for them to do, and they're not going to pay just the ASC or just the doctor. They pay me for everything at one time, and then I pay all the vendors. So the nice thing is that nobody knows what I'm paying to anyone except the doctor, the ASC, and the anesthesiologist, because they don't see it. If they needed other testing, for example, let's say they needed imaging, they needed blood work, and they needed physical therapy afterwards, I still put all of that into one bundle. Now the insurance companies can't do anything because they don't know any of my individual numbers and the overall price point. When I say, well, great, you've added up all your services, I'll add up all mine. Let's see who's got the better price and who had the better outcome.
Wow. The company, and you're really highlighting this, the company provides this concierge services to assist patients throughout their healthcare journey, from selecting a surgeon to post-operative care. How does this personalized approach impact patient satisfaction and outcomes?
Well, let's see. I think it's kind of the only thing you're looking at is really how well they heal, right? By making it personalized, we tell the patient exactly what's going to happen. So I was just talking to another group today, and they do a different model. And I said, well, did you get an insurance? Like, did you get a card? So we give them an eSurgeries card. They go in with all of our information. So all the claims come to me. All communication comes to me. But when we talk to the patient, we're like, this is what's going to happen today. You're going to go in for a consult. The surgeon's going to see if you meet requirements, if you meet the protocols for the prior authorization. If you do, he's going to tell us, and then we're going to set up your surgery. So we kind of walk them through to know what to expect. Most patients have no idea. I've had several patients go, oh, I thought the day I went in for the consult, I was having surgery. Like, they don't even know what they're doing yet. How do they know what to bring to the OR? But they don't live in the hospital world or in the ASC space. So people have to know, like, I've got to order, and I'll just say for like orthopedics, you need to order products that are going to fit the person, right? So you need to know what size they are, how big they are. And are you going to use a Stryker product, or are you going to use a different product? Like, all of those things have to get ordered. But we still want to get from patient consult, because when we give a referral to a surgeon, we give them all the records. So you're going to get imaging, blood work, the referral from the primary care doctor, but you've got everything to say, yes, this person meets requirements. We're going to get them on the surgery schedule in 3 days. Right now, that process, without walking in with your records, takes 60 to 90 days, because they've got to call all of these other providers and say, can I get the notes from Suzanne Webb? She was in to see you. I need her notes. Can you guys fax them over? In a month, they'll get faxed over. But in the meantime, you're stuck. You can't move forward. You can't do anything. The hospital's waiting on data. And like I said, in California right now, I've heard of people waiting 6 months from consult to surgery. So not only is that inefficient, imagine you're a surgeon and you're only doing 2 surgeries a day at a hospital. And now all of a sudden it's taking you from consult to surgery to get your product done. You don't get paid anything for the consult, right? Your money is made when you do the surgery. So that's where it's not just that it's quicker and that it's better and that it works more efficiently. Surgeons are happier and they want to work in this model because I've sped up their entire process. So they're like, I can go from consult to surgery in a few days. I just tripled my revenue. So if you're making $300,000 right now, you can make almost $1 million. Why? Because I got rid of all the extra workflow issues that are just delaying treatment and delaying revenue for our doctors and for our hospitals and for our ASCs, right? So those are some of the things that we came up with internally to say, this is ridiculous. I don't want my people waiting. I want to speed everything up. So hopefully that kind of answers the question.
Absolutely. I want to also get some industry insights from you. You've mentioned that, the higher administrative costs contribute to the increasing unit cost of healthcare. How does Exclusive Surgery Solutions address this issue to provide more affordable care?
So the things I just told you about, they have to have people. So they have enough. So every hospital probably has 40 people in their business office right now requesting medical records from other offices. They're calling up the labs. They're calling up the imaging. They're like, how do I get this? Nothing is electronic. Everyone goes, oh, we've got electronic med. Nobody has the connection between all of them. So a person like me would have to go in and call every one of the providers and then wait on the fax until they do. Normally, the person's going to have to make 5 or 6 phone calls, because even at the doctor's office, they don't have someone on hand to fax records over, right? When you go into your primary care doctor's office, there's one person taking your copay, telling you to go back and see the doctor. So that person's maybe going to spend 2 hours a day faxing records. That's it. So when people go, why does it take so long? It's like, that's not her main job. Her main job is to greet the patients, collect the copays, make sure the vitals are done, make sure all this is, we're not here for paperwork stuff. And by the way, we're still faxing records. So talk about control and everything else. The hospital systems right now spend over $200 billion in just faxing. Is that a waste? Like, can you imagine right now, I go to Trump and say, you want to make healthcare more efficient? Stop faxing and actually let's do things electronically to the patient. Because this whole thing is stupid, but it's also gums up the system, right? It's just a slow, arduous process to get these records and get them in. And by that time, the patient may not even come back, because actually Hospitals lose $20 billion by patients not coming back after they've come for a consult.
Wow.
Because it takes 3 months. At 3 months, you're like, okay, I've learned to live with the pain. I'm good. Or I went to a physical therapist for a shoulder. I'm not going to have surgery now because I've moved on from my need. And that's the whole thing. When you're trying to get a patient in for surgery or anything else, you want it to be quick because you don't want to change their mind. Nobody really wants surgery.
So the concept of bundled payments is central to your model. How do bundled payments at ambulatory surgical centers compare to traditional billing methods in hospitals? You mentioned this, and I really want to highlight this.
So the biggest thing is we're not adhering to just a fee schedule, right? Because when patients come in, and a lot of people want to do this, especially in cost cutting, they're like, oh, we're only going to pay the doctor for one code. Guess what? He's going to do one code. I'm like, surgeon, you're in charge. You do whatever the patient needs, and I'm going to make sure you get paid. That's it. Those are the instructions. You're the surgeon. You know everything. I don't want you wasting my time going through all the CPT codes. You do whatever the patient needs done, and we're going to figure it out and get you paid accordingly. That is an entire change, even from hospitals and every other, even other ASCs right now, because they don't bundle. So they're going to say United Healthcare only covers this code for this procedure. Guess what? You may need 3 codes for your shoulder because it moves laterally, it moves up and down, it moves all over. Those are different areas. So you may have to go back 3 times in a United Healthcare place because they're only going to approve 1 code. That's just dumb. And it's not good for the patient. It's not good for the facility, but it's also not good because the surgeon didn't get to do what he wanted. So at the end, he's responsible for the patient's care. So I have so many doctors that are like, I'm tired of the game. They're great surgeons. They just don't want to be made to play a fool anymore, right? Because they're being told I can only do this 1 code. So I can fix this one thing. You're going to be back in 3 months because I didn't get to do the other part that needs to be done. And it's really made care worse, caused more infections and more problems because you didn't get to finish the job. It's kind of like going to someone who's fixing engines and saying, you can do everything, but don't put the oil in the engine. We don't need that. We'll come back in 3 weeks for the oil to go in the engine. That's stupid, right? You would never do that with your truck or your car because it's part of the process. In order for me to drive my car home, it needs to have oil in it. They're making it hard for doctors to do a good job, and doctors don't like looking bad. They are connected and they want to be and do a perfect job every time. And so an insurance company says you can only do this, and they're limited because the hospital says you can't do the other codes. We're not priced for it. We don't have the money for it. You only do that 1 code. You've now broken down the whole system. And that's kind of what's happening. So my whole process is, surgeon, you're the guy that's the expert. You do everything you need to do. I'll make sure that you get paid, but I'm not limiting your ability to do your job.
That's what it sounds. It sounds like the current system. I mean, it's so fragmented that the surgeons themselves, in this example, like they're siloed, like you're saying, like it may take 3 codes. But yet, and that prohibits the surgeon from doing the first part simply because it's 3 parts, maybe 2 get paid. Whereas you're really you're like unfragmenting and simplifying an overly fragmented type payment system.
Right.
It's like, again, do your thing, doctor, whatever that thing may be, whether under current conditions, it's maybe 3 codes. And also, I think that helps the front end, does it not? Because again, now that person's not having to do 3 codes or know what those 3 codes are. Know this, so it's and also the client's winning because they're getting the surgery they need. So I mean, I see a 3-front win here. It's like the patient's getting what they want, the person billing is spending less time on codes, and the doctor's doing the thing that they want to do and that they're best at.
That's right, and that really is it. Like people go, well, that's just so simple. Why aren't other people doing it? And it's like, because they're all in a managed care world, and in managed care, the insurance company wants to control the doctor. Does that ever work to control the talent? I mean, think of any professional sports team. Can you control the talent? No, they're going to do what they do because that's who they are, right?
The best you can do is coach them. That's why the motto, like you can take sports, you have the coaches. You don't have it's not that the coach would manage, right? You like a baseball or football. You can only have 6 passes today, or you can only no, go out there and, I can coach you. I need you to throw it to the end zone. The talent has to do that.
Right. And they're going to do what's right at the time. Like you're not going to go, LeBron James, no more 3s. You're going to do layups all day because we don't want to.
Right. Exactly. That just doesn't even make sense when you compare it.
Right. And like Steve Curry, don't go beyond the center court, right? We don't want those spectacular throws that you do to actually score those 3 points. We'd rather you come up closer, right? No, you'd never do that. But in healthcare, for some reason, they've decided
That's the exact
because they're
model
the
it sounds like
payer,
we've got.
they get to break the spirit of the talent, which is the surgeons. That's why more ambulatory surgery centers are owned by doctors. The difference is hospitals are not really owned. The surgeon doesn't have any stake in that hospital money. They get paid their professional fee and that's it. In an ASC, and this is why I love them even more, because the surgeon owns them, it's kind of like when you have a friend over to your house for dinner versus going to a restaurant. When you have someone over to your house for dinner, you have like the best food, you make sure the best wine, you make sure everything is to the top level of what you want, and you want to entertain people, right? That's what it's like to go to versus going to a restaurant where you're like, yo, the chef isn't even in tonight. We got like somebody for the line cook who's taken over. We have no idea what it's going to turn out like. No, when the ASC is owned by the surgeon, you walk into a spotless facility. Everything is where it needs to be because surgeons are type A. Everything has to be organized. There is not a case of equipment not showing up on time because he checks everything the day before. It's his shop, right? It's his place to do his work. Nothing is forgotten. In a hospital setting, you're lucky if you get the instruments that you want to go to the OR because the person who makes the least amount of money, the scrub tech, is actually the one setting in all your instruments. And the surgeon doesn't come in.
Like the ASC, I love that analogy. The ASC, and do you want fast food or do you want to host? It's completely two different experiences. And really, the point that I don't want to be missed is like we're really not even talking about yourself and whichever one you prefer. But it's like if you were hosting someone, would you rather take them out to the restaurant or would you rather host it? And it's like completely two different experiences. Would you rather take them to the fast food or would you rather host in-house and you control everything? And it's like I love that analogy to the AC versus, the traditional hospital.
Right. Yeah. And when you think of it that way, you're like, of course, why wouldn't I want to go where the surgeon is the most comfortable, where the team works together? So that's the other thing that's really different.
Sticking to the analogy, you'll be sitting in their living room, so to speak.
Yep. The same, right. And same thing, like you have the same team all the time. So even if you took Steve Curry right now and put him on the Phoenix Suns, he would not be a rock star. Why? He has no idea how to play with the rest of the guys on the court. Right? But when he's on his team, everyone knows how he's going to play and they know exactly when to give him the ball. That's the problem with when you go to a hospital and you're a surgeon. Nobody that shows up that day, you may not have ever worked with any of them except the one PA that you bring. Everyone else is brand new. Wow. And you have no choice. You have no controls over
whoever that's running that shift. Wow. I've never really, I've known that, but through other healthcare professionals that are friends, but I didn't really consider like the ramification. Like, it's whoever's on shift on that particular shift, from the surgeon to the nurses. It's like, and you don't necessarily know who the other one is.
Right. And that's where, like I said, it's completely different animals. Everyone goes, oh, it's the same. No, it's not the same at all. It is not the same. Also, you could have a resident, and when I say a resident, I mean someone who just got out of med school 2 months before doing surgery. And guess what? They don't know anything about surgery yet. They're certainly not board certified because they can't sit for their boards for at least 4 years. So if they're not good enough to sit for a board for 4 years, why are they cutting into somebody?
That's a rhetorical question. Unfortunately, it's an existential question.
But that is something we have to look at because you can do things with robots now to actually train surgeons where they don't have to use patients as practice dummies. But they use patients right now as practice dummies, and those patients have to come back because they didn't get a good job the first time. And that was fine back in the 80s and 90s, but now that we have better technology,
we should progress. We should
not
evolve.
Okay. Yeah, that shouldn't happen anymore. And a lot of times they're like, oh, well, the resident doesn't get paid. So I'm making more money as a hospital. So that's something to think about.
Wow.
Residents don't get paid for the procedures. They get a flat salary for working at the hospital.
That's almost rhetorical in a model. I mean, that's almost bad in a model because then you get rid of the vet. So it's like you take low experience, and then since you're not compensated based on the verb itself. I mean, where's your smack on the hand when you do mess up? I mean, it would almost make you lead to believe just based on those alone why we have the errors we do, and why, as you're admitting, that patients have to come back. It's like, well, because you had a resident in there. It's that simple.
Well, and we don't have, so in the past, so I'll say, go back to I've been doing this since the 80s and 90s. The surgeon that was over, let's say they had 3 surgeons, right? They would rotate through the ORs and make sure that everything's fine. And they would have a capable PA in the room that was watching the resident. They don't have that anymore. They're low on surgeons. They're low on everything. Nobody is watching. Nobody is looking at what's happening because, one, you can't, it's just a mess. And it's just something that
nobody is watching, but everybody is billing, and that everybody being sourced back to the insurance managed payment policy we mentioned earlier. It's like, that's 2 things that shouldn't actually go together. And that's exactly the model we currently have. This nobody watching / this managed payment insurance derivative plan.
But not only that, the person that does get billed on that claim is the surgeon who's over everybody. So he's got the highest fee schedule because he happens to be the one that's teaching all the surgeons. So he'll bill for 8 surgeries that day because his name goes on the bill. He can't put a resident.
Oh, wow.
They're not showing up anywhere. The surgeon of record is going to be the guy who's overseeing all of those surgeries. Now he's doing his own surgery, so he's getting paid for that too. But you just got paid the highest fee schedule because he's the longest,
not because he was necessarily the one that did your surgery. Wow.
Right. And that's why you can't go back, because you can't sue somebody who's a resident. So the only person that has malpractice is that surgeon who is actually overseeing everything. The other ones, you can't sue them.
There's so many errors, and then you're pointing them out. And I think the real Achilles heel here is that the simplicity, once you realize, well, of course, it takes the complex, your industry experience, but it's like, once you nail it down, these problems are really simple. Again, no one's watching. The way the payments currently work and the derivative, how it's like, these are simple once you have, decades worth of experience to boil them down to their simplicity. But then at their simplicity, it's almost, it's gut wrenching.
And that's the whole thing. It's one of those things where we don't manage hospital staffing and hospital patients very well, right? Because it's supposed to be like, oh, well, we just got, no, guys, it's taking you from consult to surgery like 3 months. You have time to schedule out and plan for all. I mean, most hospitals have maybe 36 to 50 ORs happening at a time. Now, someone might go, oh, well, that's really just too, stop it. We have that many classes going on in schools, right? It's not like you don't have the expertise to do management of people and resources. And right now that is on such a low scale that it's really getting out of hand. So that's why when I say, why do I pick, and I'll even push with the UCLAs and the USCs, that I'd rather go to the ASC and use the same surgeon, but go to the ASC where there's no infection. And we do that as well, because the surgeon's like, yeah, I've got privileges to go everywhere. So those are the things that I can pay him more money in my system than what he makes to go to the hospital, because I don't have a fee schedule limiting him on what he's going to do. He could do 3 codes. He could do 4 codes. I don't really care what he does, but he gets to do the job he wants to do because I'm not limiting his performance.
Let's switch to future vision. What are your goals for Exclusive Surgery Solutions in the next few years? And are there plans to expand services or enter new markets?
There is. And so part of the expansion you already know about, we took our internal process and made it an external process with ES Digital so that every patient can own all their records, so they can do the heavy lifting and not wait for 3 months, right? Like, you own your records, get all your records, put it in an app. Now, when you go to consult, you can share all of that information with your doctor. Now, that hospital just became more efficient because it freed up somebody downstairs in business office that's not calling for all of your records. So now we're efficiently using the people better in business office as well. Make sense?
Absolutely.
Okay, so that's one.
Go ahead. Please finish.
No, I was going to say, so that's just one of that's a slim problem. That just added a couple $100,000 to the bottom line of that hospital.
Compounded. That's what I was thinking. It's compounded.
They just got a big bump, and they also now are more efficient because they don't have to be the ones on the hook for delaying consult to surgery, right? So that was one thing that we've done. The next thing that we're doing is we're actually going out more to even just the private pay. Right now we do all self-insured employers. So we're going to people that are doing different models to say, listen, if you want to pay cash, you're going to get a much better deal from me than anyone else that's trying to do this, because we're going to do it correctly and we're going to make sure that it's done right so that you get the product that you deserve. So there's a lot of those companies like mine that are saying we can save you money. I'm pushing more on, I can get you a better surgery and a better product. And at the end of the day, that's what I measured everything by. Because of that, we have gotten people, we've just grown crazy in the last couple of months because everybody's like, why isn't everyone else doing this? Why are we not helping the talent? Why are we not respecting them? So I was looking at some of the numbers in the next, right now, we did about last year, the year before that, about 50 million surgeries were done at ambulatory surgery centers. So when people go, oh, we don't know of them, they're everywhere. We had over 11,000. But the hard part is because they're not in a referral system with primary care doctors, we're now going to primary care doctors and actually saying, put us into the referral process so that you can actually get your patients scheduled. Like, don't just send them to Banner, send them to us. We'll get them to the right place. We'll get them all paid for. So a lot of that kind of stuff is working in the growth that we're doing because they are available. But once again, even you probably don't know the ambulatory surgery center in your area that does spine surgery, right? Because you'd have to know who's the surgeon, are they privileged, what days do they, it's really complicated. We're making that whole process easier so more people can come through our company to find ambulatory surgery centers in the area who are the specialists, and how do you do that? So we're working more in that
and
space.
Also working, like you said, with the referral, getting inside the you could say, I don't like to call this term, but the traditional system, and getting the doctors to refer not just what they have been, but like getting them to refer you, so that, again, because you're this bigger web of network than what is currently existing.
Correct. And this way, and what we're finding now, because we're going to a lot of the DPCs, the primary care doctors, and saying, offer our app to your patients. It helps you become a better doctor too, because now your office doesn't have to fax things out or wait for them to have a procedure. You're more efficient. But not only that, we do a revenue share with you. So you'll actually not have to be paying for an EMR. We're actually going to give you money to help your patients bring in their own records to you. It just, like, in order for doctors to do stuff, you got to pay them. And it is something where you have to change your routine. So I should have to pay you to change your routine. So if I say, please have your patients do this app, now when they come back, because we're able to sell them different testing. So like we have a PGX test right now that hospitals don't offer. It's only cash. Doctors don't offer it because they are intimidated asking people for money. So this test is like $400, but it's like 60 to 80 pages, and it tells you what medications work with your genetic code.
So really, you've removed all the barriers for the doctors listening. You've removed, not only have you removed all the barriers, but you're also vesting them into and I love how you said it. Since they're doing something different, you're compensating. It's like, so again, you've not only made it frictionless, but you're vesting. I mean, if there was ever an example of win-win.
Well, and that's where entrepreneurs have to know. In order for us to get things done differently, like even for my surgeons at ASCs, I pay them more because I let them do all the codes. And people go, oh, okay, I make more money if I get an eSurgeries patient in than if I get a United Healthcare patient in. So why wouldn't more people want eSurgeries versus United Healthcare, right? Like, it's just common sense. But yes, everyone should be compensated along the way, because I think that's part of the problem right now. We're trying to do cost containment on something that shouldn't be cost contained. Don't cost contain your surgeon. You want to do something, get a better price on the implant, right? You want to save some money, do the other things. So we also have the rates with like pharmacies, for example. So I can actually get pharmacies and labs and everything at cost. So now if you're running an office or an ASC, you want to cut all of your costs right now, even for like your epidurals. Stop buying that product from Johnson & Johnson and buy it from the pharmacy, and actually get all of your supplies at 50% off.
Wow.
Now everything you do, you make more money on. And that's what every business has to be able to do, is you have to look at, where can I cut costs without cutting service? Where can I actually look at these things and make wise choices to reduce costs or improve my bottom line? I want to keep more of my own money. So that's where you've got to be able to look at all those things and say, okay, if I sell this to you, you're going to actually be able to do an epidural at half the price. It's simple. But people
it's like that. It's like the work, knowing the inputs of that workflow. It's not like, I love that example of, don't just cut, X product or limit, which takes away from your algorithm of saying don't cut, but don't depreciate the service. It's like, well, this may depreciate the service. If you're only looking binary at the bottom line, it's like, well, that's going to take away the service. Whereas instead, nothing could change except, instead of going direct to Johnson & Johnson, you go to the pharmacy. And it's like, that's such an astute point that, again, you're not taking away from the service, but you are lowering your bottom line. So you can do both.
Yeah. And that's what everybody in healthcare, everyone in every business has to look at, right? Like, if you can get things cheaper, but it doesn't change the outcome of the product, then you cut costs where you can, because you have to be more efficient. In this day and age, people need to actually make more money. That's just a fact.
How do you foresee the role of ambulatory surgical centers evolving in the broader healthcare landscape?
I think that's just going to keep exploding. I think, like, right now, there's about when I looked at this thing, it was 6,000 hospitals. Now there's probably about 4,000. We are going to be on track to have 13,000 ambulatory surgery centers in the next 2 years. So just by square footage to square footage, remember, when you go to an ASC, you're only going there for surgery. So they're more efficient. I think that they should be built everywhere and have more specialties done that way, because it's when you get so big. I mean, come on, these hospitals are like half a city block, right? And I mean, you're in Virginia. It's the same thing. You look at a hospital, you're like, why do you have to be 5 stories and a whole city block to do the stuff you're doing? So we didn't build hospitals with efficiency. And I think COVID taught us that, when they had to go like, oh, we got to close like 5 floors of a hospital. You can't close 5 floors of a hospital. So they were still paying all of that heating and air conditioning and all the rest of the costs, because they can't manage it. Ambulatory surgery centers can be built to service an area, and they can do up to 2,300 different specialties. So it's not like they're limited in what they do, but they are limited on the group of people they can do work on. So you have to be healthy. So it's really for all the employees, right? You have to be healthy. You can't have a BMI that's too high, which means you can't be too overweight, just because then you comorbidities. So we want to get healthy people in there. I was just talking to someone the other day, and I said, could you imagine if all the hospitals took all of the adolescent Medicaid business and moved it to ambulatory surgery centers? They'd actually make money and actually be able to take care of all the Medicaid kids in a very short period of time.
Wow.
Right now, Medicaid is not allowed to do that, and they have to go to a hospital because of licensing requirements. But that is one thing where it's like, right now, we would save billions of dollars. We would change that for a cheaper price. Everybody would get service quickly. There'd be no infections, but we could actually get rid of some of these bogged down things that aren't efficient, right? And like I said, I talked to the one guy, and he goes, yeah, we could save, we'd actually probably be a profitable hospital, because remember, Medicaid is a push. You don't make a profit on that. You get a tax benefit. So a lot of people come in and they go, why can't we just charge Medicaid for everything? It's like, it's a push. You add up all your costs, you do a cost reporting, everything is paid at cost. Well, your business runs at what, 30% margins? So what they do is they say your revenue for Medicaid will not be considered taxable revenue. So we're giving you that as a push, but you're not paying taxes on it. Once again, giving you back that 15 or 20%, right? So it makes sense, but people want to access that fee schedule. You can't, because you have to do at least Medicaid plus 15 to actually make it like cost equal. You know what I mean? And so those are some of the things that we're trying to get out. So some of our expansion is going in and training CFOs and other people at hospitals to understand how to really run hospitals and make them more efficient. When you lose, I think we had 1,500 closed just because of bankruptcy, which means that they didn't really understand how they were making money anymore. I'm going to go in and actually kind of help some of those facilities to go, this is how you add money to your bottom line immediately, because we need you to stay in business.
I want to move to shift to get your insight towards, and the most of our audience is the entrepreneurial community. So this is the advice for entrepreneurs. As someone with extensive experience in healthcare industry, and I want to pause for a second and say, in industry, I believe that there should be a lot of entrepreneurs aspiring and forthcoming in this particular industry. What advice would you give to entrepreneurs looking to innovate within this particular sector?
It's really hard in the hospital systems. I'll be honest with you. In healthcare, it is hard to innovate. I was very fortunate just because I was working directly with the surgeons, and I can actually do things a little bit differently. If you're outside the healthcare system and you're trying to bring in a new product, the first thing I'd say is research everything. Research, has anyone ever made this before? In the last 40 years, was it implemented or did it fail? Because a lot of the stuff that's coming through, I was like, we already did that back in the 80s and it failed. There's no reason to try to reinvent the wheel. Do your homework. So do your homework on what you think is needed, and not just something that's like, hey, this is a good idea. Because a lot of things have been tried. Also, really make sure, so our thing is being paid, our app and even all the services we do are paid by employer groups or patients. So we don't really go outside of that two areas. So make sure that the people, however you get paid, make sure that that is something that can last forever. So I know right now there's a whole bunch of rich people that I could always send to ASCs and really work my whole thing just working with people that have money. If you're relying on a Medicaid or a certain insurance company or a certain payer, don't do it, because that payer may not be around in 5 years. And what they're trying to do might sound really good to you, but if one payer is trying to do it and another payer says no, there's something going on there, right? Because no one does a payer specific. No one says, Blue Cross doesn't say, I'm going to do this new thing and no one else is going to do it, right? It's normally opened up to everybody. But I've heard of a lot of these new startups, like, we're only selling to Medicare Advantage. Stop. Medicare Advantage has no money. And if you're only selling to them and not selling to the Blues, why isn't the Blues buying from you? What's the, because that's unusual in healthcare. So just make sure as you're doing your market research that it's not just one aspect that says, oh yeah, we like this. Like, I use mine for everything, including grants, including other things that I've got 20 different revenue streams for all of my businesses, because you should never have one or two, because one or two could fail. I have 20. So you have to make sure that you're getting paid in several different ways from several different players, and how do they all work together? Do you know what I mean? Like, people are always like,
Absolutely.
oh, we're doing another revenue stream. And I was like, I want as many as possible. I think Trump was like, I want to get paid as many ways as I can. And if I can do this, that's why I said we're selling genetic testing through our company, because we were like, I know the guy who owns the lab and he trusts us to sell his product. So he gave us a very good price. So we're actually selling it at 400. Right now, people are paying 800, but we're able to get it at a discount because he trusts that we're going to sell it and get it out to a larger audience. Right.
So those are the beautiful thing of that affiliate marketing you're speaking of too, I think could be implemented. It's like there's so many other pieces and verticals, and it's like you could incorporate those. I mean, even if it's just through the affiliate marketing, which is a beautiful model, it's like sell good services, products and services that your end user needs. I mean, I don't want to take away from what you're, but it's like affiliate marketing fits in perfect here again, because there's so to these startups that you have so many other aspects that your consumer needs, or your end buyer needs. It's like you're doing the testing. It's like, work with these other companies because you have the audience. Right. And I love the vendor you're mentioning. He wants you to get it out. So it's a win-win. You get a price reduction, they get a price reduction, and they get exposed to it, and they get a great product.
Correct.
It's beautiful.
Yeah, and everything in our affiliate market program actually works that way. So in our store, it's going to all be things that people want to buy that insurances don't pay for. So there are a ton of healthcare things so I go to a lot of the conventions for all the different types of things, like whether
you get exposed to many. I
get exposed to all the surgeons, and so they say, here's the best treatment for people that have spine problems. So going to those things, you meet the very best surgeons and say, well, what patients are good for you? So there are a ton of surgeons right now that are just doing endoscopic procedures. What that means is that on your spine, and a lot of people have spine things, there is a bone that is turned and it's blocking the blood flow. All they have to do is go in with a little thing, shave that bone off, and you're done. That's a $5,000 procedure in ASC. At a hospital, that's $150,000, because they're going to do an ACDF and they're going to give you all these implants and all this other stuff. It's the bone that's got to be cut out from your spine. That's it. That's what I'm saying. There's a difference in care models that exist out there as well, besides just
the intimacy and the resonance of it. It sounds like not. I mean, I'm oversimplifying, but the intimacy. And again, the resonance, it's the type of recommendations you can give are completely different than the current model. Like, again, that $150,000 surgery, which could have been done in 5 if they'd only known.
Right. And that's the whole thing. Most people don't do that because they're like, well, the hospital wants to make the 150. I said, yeah, but that patient doesn't need that. So that's the difference in our service. We're not just looking for what is the best.
The 5,000 or the 150,000 is what is optimal for that client.
Right. That patient only needed. So the doctor that I met that did this, he was a great guy. I had met him at a convention. When I went to his ASC, he's like, I want you to talk to my 12 patients. And I was like, I'm sorry. I don't talk to patients. Like, what for? And he goes, because all of them were in a wheelchair until they saw me. They couldn't even walk. And so each one of them. So what I love is the people that I work with, they're going to give you patients that you can talk to say, oh, you want to know how good I am? Let me show you. That's what's really cool. That's what I'm saying. Like, wow. What we're doing in healthcare, it's not just, oh, we're cutting costs. It is great because a lot of these surgeons can't market what they're doing in a way to get the patients that they can take care of, right? Because now I could say, listen, everyone that fits this criteria, there's like 4 docs in the whole country, that's it. But when they do your procedure, you'll be up and walking in 30 minutes after he finishes the procedure. That's what I love to do. That's what's really
Wow.
fun. When you can say, you have all these 12 people. And he goes, by the way, these are all the 12 that I did since the convention, and I met you 2 weeks ago. And I'm like, oh my gosh, doc, you're cool. But you're also making sure that you're getting the right patients for you. And that's the difference between people that own their own surgery center and doctors that work at the hospital. It's that ownership of, you're going to take care of every one of your
That
patients.
vested schedule, if you will.
I'm sorry?
That being vested schedule, if you will. They're vested in a completely, and again, I think that's what I'm saying, resonance. It's that resonance, and they're vested. The way you're describing these doctors, they're vested in a way that even the best surgeon in a hospital is not.
Right. And they don't have the same relationship, because they're like, you came into my house, you came into my ASC, right? You came in, you got to see me, you got to see like my staff, because the one thing that's really nice is they pick people they like to work with. Like, it is so ridiculous. People go, wow, why was the staff so friendly? I'm like, because the owner picked everyone that's here, and he picked all people that he gets along with. And so the one thing that you'll see after this thing, you'll go to a hospital student, you'll go, wow, there's friction between all the employees that are even in the same OR. It's like, yeah,
you can sense it even from afar in most hospitals. You don't even have to really be there for service. You can sense friction. Somebody's yelling at some employees, yelling at somebody. You can sense it, and you don't even have to be looking that close at a hospital. Right. I mean, again, the staff yelling at each other.
But that's the whole thing. It's like, when you get people that actually work together, and like I said, 50 million surgeries were done. When you see that, and you're working with the same team every day, and remember, most of these things, just so you know, for ASCs, we're talking a normal day, 9 to 5. These surgeons aren't being called in late at night and have to do other things. They're literally working a better life for life-work balance, right? Because they work during the day. Their nurses aren't working overtime on Saturdays and on Sundays and being called in at 10 o'clock at night. No, they work normal schedules. So
I don't
that's
want to be
where
overly simplistic, but happier people make make better products and services. It's all a derivative of human labor. So it's again, I'm being maybe a little oversimplistic, but these are happier environments. These are better environments, however you define better in any sense. And these, as you're saying, even just the doctor picking, the surgeon picking the staff, but staff that gets along, and all these things at the end of the day make a better product and service.
Right. And it's just like everything. And like I said, I could go on and on with that, because I think that's where the change is going to happen from hospitals to ASCs. Now that people are familiar with them, they understand them. A lot of people have been to them once or twice, but we're going to start marketing more so that they understand that the difference is not just the outcome and the quality, it's the entire experience. Like,
literally,
when I go into hospitals now to visit people,
yes.
I'm just like, oh my gosh, I can't believe I have to come here. I mean, and the worst thing is that because it's not that same team mindset. I was just at a local hospital, a friend of mine had surgery, and the buzzer in their room kept going off. And I was like, it was blaring. And I was like, oh, what is going on? I go to the desk. There's 3 people. They're all talking. I was like, do you guys hear that loud buzzing that's coming from the guy who just had surgery? And they're like, yeah, we'll get to it. I said, no, push the button on your desk and turn it off. And they went, oh, okay, we can do that. That's what I'm saying. That's a hospital experience, because it's the latest one. I don't go to hospitals very often because I try to reroute everyone to ASCs. But just that difference is like, that's not acceptable. That's not acceptable. Like, you didn't push a button.
That's not marginal. It may sound marginal in the scheme, but it's completely not marginal. Sitting there listening to that buzzer and over, and meanwhile, the whole solution was they just could have turned it off. It's
right.
Seemingly marginal, and yet it's completely not. I mean, and you're right. That's though a marginal example of the macro examples. Even that just shows the difference in the two experiences.
Right.
Well, last question here. What challenges have you faced in your entrepreneurial journey, and how have you overcome them? I know that's a broad question. But
well, basically, every single one of the businesses I've ever started, even when we were doing the billing, everyone's like, you can't do that. You're never going to be able to just make enough money just doing like this, like just surgeons and ASC. It's like, at the time we started, nobody was spending just doing their business on that, right? At the time, remember, it's before Obamacare. So we're talking, people were still doing claims by hand. Like, people like the doctors' wives, like, you guys may not know this, before Obamacare, you could literally take a form, fill it all out, and mail it in to the insurance company and get paid. Now we've made that process so expensive. There's so many more claim denials. Guess what? We had no denials. There were no claim denials because it wasn't a machine. You literally were mailing it in. It got to claims processing and you got paid in 7 to 10 days. Life was easy in healthcare back in the 80s and 90s. Once Obamacare came and everything was going to be electronic, now we have all of those denials that happen because it's really easy to set your computer to deny everything, right? But all along the way, people were like, okay, you're going to go after this audience. You're going to get big enough. So what we found was when we started our billing company, everything was by referral. I could not afford to put out $50,000 for marketing. So we would take care of one surgeon and do a great job, and he'd refer us to 2 of his friends. Once we did a great job for them, they'd refer us. So we got into Los Angeles and some of the other areas. We started taking care of all of the Jewish doctors because they are a very knit group and they refer to everybody that's within their circle. That's how we grow all of our businesses. Even now, we do everything from do one great job for an employer. That employer then refers us. So we're in like 7 TPAs now, all by referral, because this is something that it's kind of hard to just go. Everyone's got high-priced marketing guys that are like, will probably be more impressive than me in a marketing meeting, right? Because they'll have the right words and they'll be silver-tongued with everything. And I'm just like, just give us a try. Give us a try. And if it doesn't work for you, we'll stop ourselves. All right. We haven't lost any of our TPAs since we started in 2017. We still work with all of the same clients because they're like, you're the best benefit we have. Our employees ask for your service by name. Nobody in the world, they're like, wait a second, you've been doing the same clients for 7 years? Brokers go, they flip every 2 years. There's not an employer group out there that's going to keep the same service because we turn over every 2 years. That's why we got to market all the time because we don't get to keep our clients. I was like, oh my gosh, that'd be exhausting. I'm like, no, we just keep doing a good job for them and they refer us to other people. So I think those are the kind of things that I'd say to anybody that wants to be an entrepreneur. Make sure that you've got a product that when they use your product, they're so happy, they do your marketing. Right? Because right now everyone's being told, send 1 million emails out, do this, you're going to get 3% of this many.
Nothing like a satisfied client. I mean,
yeah,
word of mouth is the kingpin.
Right. And at the end of the day, when we went in to meet with these new groups, the weirdest thing was they were like, you don't have to tell me anything. Dr. So-and-so just told me all about you and what your service is. You're hired. When can you start? And I'm like, okay. So, but that's what I'm saying. When you do word of mouth, so I would get not even just your best friends, get the clients that you want and have them, and then ask
great
them,
product.
Yeah, are you happy? What can I do to make this product better? What can we do? And so a lot of the things that we're doing in our affiliate marketing now, like getting the labs and getting pharmacy and getting everything, the surgeons were like, we don't have time to do this stuff. Like, can you get these things for us? We can definitely get our patients need
So you're
this
not just affiliate marketing, it's really targeted because it's creating this marketplace that's got value, just the fact that the consumer can go there and the surgeon doesn't have to. It's like,
right.
Again, it's affiliate marketing. It's a beautiful model that you're applying because again, now as a doctor, I don't have to worry about X, Y, and Z. And as a consumer, I don't have to go to the limitless Google. It's like, no, here's a centralized, highly concentrated. You're going to need A, B, and C. And right here's where you should go. I mean, that is not just a great product. You're just building a great product services marketplace. I mean, it's this beautiful I overused phrase, but one-stop shop.
Right. But that's what every entrepreneur, look at your product. And the other thing that's really important, whatever your product is, so you're coming up with something, all of our stuff is brand new, work with others who are in your space that can be a referral partner. Work with others. So let's say that you're making the best new, let's just say blueberry muffin, whatever. Go to restaurants, go to other places, but work with other vendors that are currently selling to the same client. How did you get in? Ask them questions. What did you do? Like when we got into the self-insured marketplace, I'd never been a broker. We went to brokers webinars and brokers classes, and we went to all the brokers training. And I said, what is a broker and what do they do for these employer groups? Like, how does this all work? And really get educated in the space you want to live in and make sure that that's really what you want to do. I know a lot of people that start and then they're like, oh, I didn't realize this is who I had to sell to. Or I didn't realize that this product that I have, the audience that wants to buy it is over here, but they don't have enough money to buy my product. Do all of that work ahead of time. Do your due diligence. Make sure that you're doing the costing. Make sure that you're looking at everything to make sure that what you're doing is one that you want to do. So I have a really good friend of mine who actually came up with a new cookie that she came up with her own sweeteners because she can't have any sugars and can't have anything. So she went out and I said, is this what you wanted? Like, investors would come and say, I want to invest in your product. And she goes, no, I want to make all of these. I'm making them by hand. We only can do this many. She's tripled in size, but she's like, I don't want to be a 50,000 unit company. I want to keep this to be a small niche market because I'm happy.
Mm.
I won't make as much money as everyone's saying I can make, but everyone that gets my product, I know who they are, and I love that. I love that niche that she's in because she's happy. Her husband's happy.
Mhm.
I'm like, there's something to be said. Entrepreneurs are always like, how do you make your first million? How do you sell your stop?
But are you
Do
happy?
do something that's going to make you happy. As you can tell, I love making surgeons happy and helping patients and doing that. If you don't love that space, don't look at it as just the numbers. If you say, hey, I'm going to go do X and I'm going to make this much money, don't. Do what you love. And if you make less money, then pick up a side job. Like, I know that people hearing that go, why would I do that? I'm like, because you might need to, especially in the beginning. But if you don't love what you're doing, believe me, I've been doing this since 88. I'm still doing it because I love the space I'm in. So find the space you're in. And like I said, I've talked to a ton. We have a lot of startup stuff here in Phoenix, and a lot of them are like, well, the last 2 companies sold for like 8 million. I guess I could probably make 5. Like, stop. That you're never going to make 5 if you don't love what you're doing, right? Like, you're never going to get there because if you're not happy, your customers can see it.
Again, you're making a parallel here. Happy people make happy products and services, and to make this pristine, this product and service, it's through the kingpin word of mouth actually works. It comes back to those are overly verbose ways that skip around. You have to like what you're doing. Again, I'm being overly simplistic, but it's like.
But it is for the new entrepreneurs because literally they should be able to say, go to your friends and family. Do they want to buy what you're making or what you're creating? Do your own family research before you get so far down the road that you're like, why didn't you ask us if we needed, like whatever it is. Like I said, I've heard some very strange things. I'm sure, Jason, you do this for a living, so you've probably heard stranger things. But it is, you have to talk to people and then go, okay, if 50 people don't think what you're doing, like outside of healthcare. So I'll be the first one when people said, well, why would we need an app? Now people are like, oh my gosh, I wish everyone in California had my app. So all of their medical records would be saved on their own device or their own thing right now. So they wouldn't have to be going, what prescription was my kid taking? Because the doctor's office is gone. What was the last surgery or what was the doctor having us do? Like all of that data is gone. All of those people are gone. Okay.
Now we need the app.
If they'd all had their medical records, they'd all be able to say, we can now go anywhere in the country. I know what my kid was taking for his asthma, for his allergies, for whatever it was, and you're still whole. You don't have to start from scratch. And even for kids, when they have vaccines and everything, I'm sorry, you had those upstairs in a file that you used to keep, like all of us did for your vaccine. That's gone. So now that hospital system may not be around. The records might be, so there might be a short window where we can help people right now get their records. But in 3 months, those records will be gone. They don't have to, they're not going to save them for the patients, right? So those are the kind of things that now people are like, wow, when you were doing this, we really didn't see the value. But now we see the value because of how it can be used, especially in a world where we're having world-changing disasters.
Correct. Suzanne, to end it, I'd like you to talk to the audience and tell them, for those that want to reach out to you, or if there's a call to action you have, if you want to send them to a certain site, how can people get hold of you, 1, and 2, if there's somewhere you would like to send the traffic, where would that be?
Probably just to my email. Everyone can go to Suzanne, SUZANNEW at @esurgeries.com.
Okay, I'll link that in the article, by the way.
And we have our ES Digital app is on iOS and Apple, so you can get it either of the app stores. So our app is out there where you can just go and get the app if you want to start getting your records and saving them and doing things. We don't need to be involved in that whole process. It literally is you and the doctor. And just so that you guys are all aware, I want to make it really clear, we can't see your records. I'm never going to sell you anything based on your diagnoses because these records are between you and whoever is the provider. We are not a party to it. And I think a lot of people, especially now where people are like, oh, it's healthcare. It's like, yeah, but it's your healthcare. I'm not a party to it. So I want people to be clear that we're the only company that's literally giving you access to your own data in your own devices without any input from us at all.
Wow. Well, that wraps up another episode of Full-Time Hustler, and a huge thank you to Suzanne Webb for joining us today and sharing her incredible journey and insights into revolutionizing healthcare with exclusive surgery solutions. Suzanne, your passion for creating better, more affordable healthcare solutions is inspiring, and I know our listeners took away so much value from this conversation. I know I did. To learn more about Suzanne and her work, be sure to check out her on LinkedIn. I'll include the link in description and her email. I'll keep that in the description, and follow her for more updates and insights. If you enjoyed this episode, don't forget to hit that subscribe button so you never miss an interview with industry leaders, entrepreneurs, and hustlers making an impact. And if you found today's episode encouraging, we'd love for you to leave a review or share it with a friend who needs some inspiration. Until next time, keep hustling, keep building, and remember, the only limits are the ones you set for yourself. Thanks for tuning in, and I'll see you on the next episode of Full-Time Hustler.
Well, you have